How restrictive are you as far as being able to comment about the truth of what's going on in the Philippines today?
I'm not sure that even answering that is the smartest thing in the world. I can say that it's a bit illustrative of what's going on worldwide in the Philippines, presumably because it is very hot here, it is very humid here, and it is very sunny here. This is not an ideal country for COVID-19. And for that reason, I would guess we have very few cases and almost no deaths. We've been running at about 10 deaths a day for a country of 109 million people. So that's essentially zero. But the lockdown, the quarantine here is about as severe as any place in the world.
And describe that for us quickly.
Well, we're very restricted by quarantine cards. We can only go within certain boundaries.
Is that on your phone in some way? Is there an app on your phone that is tracking you in some way?
No. It's just a piece of paper that, if you're smart, you laminate, because after 9 weeks, that piece of paper would have fallen apart. So you're restricted to where you can go. There's a curfew at 8 o'clock. We have no transportation unless you have your own. There are no cabs running. There's no Uber. We have motorcycle cabs. They do not run. There's no mass transportation. So basically, even if you can leave your house, there's no place. You can't get to where you would want to go. And there's nothing open. Only drugstores and grocery stores are open.
And how is the communication there from the government? As you see, I'm sure here, we got Cuomo every morning on doing his 1 hour conference. Trump's on, 24/7. You've got Newsom and Garcetti here in California on every day. Are they communicating in the same way in the Philippines?
No, it's very sparse. Every few days, they might release something, but literally within a few hours, they might take it back. And people take advantage of that, unfortunately, the people, to post false things on social media like crazy. And they will take official documents here, and they'll just change things like dates, little things like that. The quarantine will now be extended till, and you don't know if it's real or not. So it's kind of crazy here.
And how would you describe the people there? Are they relatively compliant?
Yeah, to say the least. Remember, this place was a Spanish colony for 350 years. And the Spanish, they always ruled with a jackboot wherever they went. Then the United States took over in 1898. It was a U.S. colony for about 50 years, but that didn't really have much impact. And then the Japanese took over for 4 years, so they were under the Japanese jackboot. So they've been trained basically for about 4 centuries to be compliant. So you're not going to get the kind of rallies, demonstrations, protests that you get in places like the United States. It's just not going to happen.
And if they were to occur, they wouldn't be looked upon too highly by those in charge.
No, they wouldn't.
And what about the economy? I mean, I assume this is extremely destructive to their economy, like it is these other countries. What kind of shape is the Philippines in to be able to handle this?
Well, among other things, 9% of GDP here is from tourism, outside tourism.
What percent?
That's good. 9%.
9. Mm-hmm.
That's gone. No tourism. They say for the rest of the year. One hopes that that's an exaggeration, but you can't just lose 9% and not have a severe impact. Telecommuting here is very rare because I have Wi-Fi here, but that's actually very rare. Most people just have data plans, so they can't telecommunicate. Remember what I told you about transportation? Even if their job is still open, they probably can't get to it but their job probably isn't open, this is going to absolutely devastate the Filipino economy. And it's already having a very severe impact, unfortunately, on the average person.
Are they sending out free money to people like they are here in America?
Yes, some money, but no, not like in America. No, very, very little. It depends on the area, and then bags of rice and some canned goods. These people are they're at truly subsistence level, like Americans can't even understand.
So I mean, America is in a unique position as far as having the world's currency and being very wealthy and being able to essentially print its way out of this, print money to help us out of this. Countries like Philippines, it seems to me, do not have that ability. So you would think that they would be the ones really leading the charge to reopen, recognizing that they just can't sustain the kind of economic damage that they're doing to themselves.
You're right, and I can't go into the reasons for that.
Well, but the Philippines certainly isn't unique. We have something that seems to be worldwide, and as skeptical as I am about government's response to this and essentially being a gross overreaction, and I think in general you share that view, and we'll get into that, I do check myself sometimes and think, but gosh, how could every one of these countries all be wrong? You know, am I and others that think along lines that I do, that say that this is a huge government overreaction and they're just taking the absolute wrong approach to this? Yet it almost seems like everyone is wrong except for perhaps Sweden.
Yeah, there are a few outliers, not just Sweden. Iceland basically didn't lock down. South Korea did very little in the way of locking down. Taiwan did very little in the way of locking down. And the interesting thing is that I and others who are much better at analyzing these things than I am, we find no pattern. We find, for example, let's look at Sweden. Sweden has done almost nothing in terms of locking down. At first, they restricted gatherings to 500 people. That's not much of a restriction. It means no football games, no ABBA concerts, except that ABBA is currently in hiatus anyway.
There's been talk about a comeback, though.
Yeah, they're coming back. Then they restricted that to 50 people. Well, that's still a lot of people who can get together. They closed almost no restaurants. They didn't close the bars. Very importantly, they didn't close their grade schools. The little kids have been going to school the whole time. Sweden's deaths are below Belgium, the United Kingdom, France, Spain, Italy, and those are major European countries.
Well, but hold on a second. There's been a lot of reports, and everybody's texting all kinds of things these days. The latest reports, I've gotten multiple texts from my progressive friends who think that U.S. hasn't done enough to stop this, about Sweden and their death rate of late, and that and I read them, and it appeared to be accurate that their death rate per capita now is exceeding most, if not all, of Europe.
Now, I don't get my death rates from social media or anything like that.
Well, this is some mainstream articles, because trust me, well, when we say mainstream news, I mean that's the New York Times. But we all know that New York Times has its own bent, and that the bottom line in the U.S., the breakdown is CNN, MSNBC, and the, generally speaking, liberal press talk about this thing. The U.S. hasn't been doing enough. They're on the side that we need to continue the lockdown, and then your Fox News and conservative outlets are saying that this is an overreaction. So for the New York Times, or I think this was actually the San Francisco Chronicle, to talk about the death rates in Sweden, well, we already know that there's some bias there, but still, the numbers are the numbers. So I don't know, what numbers are you seeing, and from what sources?
Various sites. One is called Worldometers. Another is the website of the European Center for Disease Control. Another is the Johns Hopkins website. There are numerous websites you can go to get the direct data.
Okay, so in the most I'll just trust you on this. So the most recent news, after you checking those on deaths per capita, which is the most important measure, where does Sweden rank among the Western European countries?
It's definitely higher than most European countries or most Western European countries. But I think it's very important to note it is vastly below Belgium, Italy, and Spain, and it's actually still well below that of the United Kingdom and France. I mean, these are all major countries. We're not talking like Slovenia or Slovakia, which are relatively tiny countries.
Yeah, I think, look, density of a country is critical. I think that's the one thing we've seen through all of this, primarily just looking at America. New York City, high density, a bit of a problem. Lower density, Los Angeles, not a problem at all. You wouldn't know that reading the media. They call Los Angeles the epicenter of the problem in California, even though our rates are just incredibly, incredibly low. But clearly you see a correlation between population density and the virus.
Yes, you make a good point. There will never be a controlled study. You will never have like a drug study where you have one set of lab rats and you have a control set of lab rats, and you give the one set the drug and you give the other set the placebo. And in fact, it would be double blinded, meaning, sounds strange enough, the rats don't know whether they're getting the drug or the placebo, but neither do the scientists. It's called a double-blinded study. That is your ideal study. You're not going to get that when you're comparing countries. We're not talking lab rats. We're talking human beings. Each country is going to have a different density. It's going to have different cultures, for example. Thus, Swedes and Southern Italians are going to interact differently. Swedes are going to be a colder people, and nothing against them. Southern Italians are about the warmest people on earth. So you can expect Southern Italians to be doing more hugging and kissing and all that. And Swedes, especially during the winter, are going to be doing less. You're going to have climate differences. I already discussed the climate situation in the Philippines, which is a very bad climate for the virus. Conversely, Sweden, of course, is a very cold, dry country, and really an ideal place for the virus itself to be spreading. So you have all of these different variables. You can't do a one-to-one comparison. I'm just saying that if you look at Sweden and the other outliers, like Iceland, like Taiwan, like South Korea, we really don't see a pattern between locking down and death rates. Moreover, this is very interesting. If lockdowns work, if they do, and Sweden's not locking down, that means basically they're front-loading their deaths. They're getting deaths now that other countries are going to get when they unlock. So it may not be fair to compare Swedish deaths to other countries' deaths at all.
Oh, I'm in absolute agreement on that. Until this thing is all said and done, we're in the middle. Who knows what inning we're in, but we're in the middle of the game here. So what their death rate is now is really somewhat irrelevant. I would say that, well, of course their death rate is going to be higher because they didn't lock down, subscribing to the idea that locking down probably does help prevent the spread. But they're playing the long game, because are you going to stay locked down until there's a quote-unquote cure, which we don't know if it will ever come, but the mayor in Los Angeles, Garcetti, he is on record saying restrictions will stay in place until we find a cure. So he has at least acknowledged the moving of the goalposts. The original goalposts were lockdown to not overwhelm the healthcare system and then start releasing, as long as there's not that problem. Well, we haven't overwhelmed the healthcare system anywhere in America except arguably New York, but even there I think it's debatable. Yet they're not easing the restrictions, or they're doing it extremely slowly, and we're now learning that's because they want to keep the restrictions in place until there's a cure. So if that's the new strategy, then that totally changes the calculus of everything.
Yes, it's important to keep in mind that only one virus has ever been cured, hepatitis C. It took decades of research before we could do that. It's also incredibly expensive. So a cure isn't even, that's not on the board.
Well, vaccine, though.
Okay, vaccine is different.
I think that's what he's referring to.
So some of these people actually use the word cure.
He used the word cure. He did, the mayor. Okay. But I think in his mind, he means vaccine.
Okay, then let's talk about vaccines. The we have a flu vaccine every year. It actually comprises 3 different strains of flu. But as many as 60,000 Americans still die of flu every year because it's not a perfect vaccine. All vaccines, in fact, are to an extent age dependent. The older you are, the less effective the vaccine. What demographic group does COVID-19 affect the most? The elderly. So the elderly are going to be the least protected by a COVID-19 vaccine. I don't care what they come up with, and I don't care how fast they come up with it. So a vaccine is not going to wipe this disease out. Basically, that we can't expect this disease to be wiped out. It's going to be, right now it's what's called epidemic level. Shortly, it will go down to what's called endemic level, which means, not high rates. It means a low rate, but it's still going to be out there. And so if you're waiting for the virus to go away, we could be waiting, I don't know, a few decades. It's not going to happen.
And that's the way in which Sweden ultimately is going to come out of this looking smart, because there is no cure for it. There is no guaranteed vaccine. Even if it comes, it's going to come way down the road. It's not going to necessarily be 100% effective. Are you going to mandate that 300 million people in the U.S. take the vaccine? I can tell you my mom and my sister ain't taking that vaccine. There's some people that are very anti-vaccine for their own personal reasons, and so be it. But you would have to mandate that everybody take it. So the only way out of this thing, it seems to me, is to allow it to spread through the community and make sure it doesn't overwhelm the healthcare system. But that's about all you can do. And yeah, Sweden may be ahead on the death rate right now, but unless America plans on staying locked down for the next 18 months, we're going to get there on the death rate.
Right. The virus is going to do what the virus is going to do. Nobody in history has ever quarantined a virus to death. And guess what? We're not going to be the first. It just takes incredible hubris to think that we are going to be the first, that we're going to lock up healthy people long enough to wipe out a virus. Now, mind you, some viruses disappear on their own. In fact, a sister virus, SARS, did in fact disappear. In July of 2003, SARS disappeared. But SARS was a different coronavirus. There are many different coronaviruses. It was it basically embedded much deeper in the lungs. It was more susceptible to disappearing. Whereas this COVID-19 likes to live basically in the throat. And so it's much less likely to simply disappear. I won't say it won't disappear. I'm saying it almost certainly won't. MERS, that was another coronavirus, and it disappeared as well. So this might disappear, but a lot of colds are caused by coronaviruses. And they don't disappear. They come back year after year after year. So we can't just presume that this virus will disappear. It would be nice if it would.
What do you think about the contagiousness of it? The early reports are contagiousness is much more contagious than the flu, much more deadly than the flu. But speaking of Sweden, we're hearing now out of there that they're surprised by the percentage of people at this point that have got it. They're estimating it now at only like 7 to 8% of Swedes have had this virus at some point. And they thought it was going to be much higher by this point.
I think some people were expecting that the antibody tests, that meaning you don't have it now, but you had it, would show somewhere around 50 to 60% of Swedes would have been infected by now. And you're right, it's a fraction of that. So this does not appear to be more contagious than your typical seasonal influenza. As far as the fatality rate goes, the CDC actually just a few days ago released a report on that. And their best estimate was the fatality rate is not 3.4%, as the WHO originally estimated, based on early Chinese data from crummy Chinese hospitals. They somehow extrapolated that to the whole world. Rather, it appears to be around 0.26%. Now, mind you, seasonal flu is thought to be around half of that. So, okay, it appears that COVID is about twice as fatal per case as typical seasonal flu.
So sorry, let me make sure I get the number right. Let me make sure, essentially 0.26%, about a 0.25% is the death rate, and that's
out of
CDC.
All infections.
And is that an American stat or is that a world stat or?
That's a world stat.
Okay, because I've been trying to get that figure on my own through doing calculations of New York reporting their antibody test results and extrapolating. Like, for instance, they say over 20% of New York people in New York City have had it. In Los Angeles, I think they're saying somewhere around, I'm kind of guessing now, but somewhere around 5% of people have had it. And when I've extrapolated, I found like a 0.8% number in New York and a 0.5% number in LA County, but you're citing a number even lower than that at essentially a 0.25%.
Right, which, as I said, that's about double of typical seasonal flu. However, the Asian flu of 1957, 1958, was estimated to have a mortality rate of 0.76%, perhaps 3 times what COVID has. Now, a lot of people did, in fact, die from that flu because it had a very high mortality rate. The vaccines did not work that year. But the question is, did we shred the Constitution for that Asian flu? A little before our time. We weren't quite born yet. But as I recall, we didn't shred the Constitution. We didn't make everybody wear masks. We didn't shut down businesses en masse. Basically, life just went on in the late 1950s, despite what turned out to be a fairly bad flu. Then there was another one that did, in fact, occur during my lifetime, although I was very young. That was the Hong Kong flu from 68 to 69. An exceptionally high death rate, much higher than the death rate we're seeing from COVID-19. Were people wearing masks? I'm old enough that I would remember that. I've got a good memory. I remember things from when I was 4. I would remember the people wearing masks. They weren't wearing masks. They weren't shutting down businesses. Constitutional rights were not suspended. We didn't go into a recession, such as the recession we've already gone into. That didn't happen for 2 worse influenzas than we're suffering now. Something very different is going on now, and it's not the virus.
All right. I'm ready for the answer. What is different about our response to this virus versus the ones you cite? Or why the difference?
It's us. It's the reaction. And I think a few things have been going on here. One is they've been working on this. By they, I mean the public health people, the media. They've been working on this since AIDS, which was the first epidemic. That's where I kind of ground my teeth, beginning in 1987. I wrote a book on it. I wrote countless articles. You may recall we were told The disease of them is suddenly the disease of us. AIDS doesn't discriminate. On and on and on, and it was all fake. AIDS was always a disease of gay men, intravenous drug users, and originally recipients of blood and blood products. It was always that way. It remains that way in the United States today. These people lied. I mean, there's no polite way of saying it. They lied because they thought they were doing the Lord's work. They decided that to the extent that AIDS was seen as a disease of undesirables, it wouldn't get the kind of attention and money it deserved. And I will grant them this. They were incredibly successful. To this day, AIDS is the second biggest line item in the National Institutes of Health research budget, even though AIDS in the United States kills virtually nobody anymore. The big killers are cancer, heart disease, anything you can name that kills people kills more people than AIDS in the United States.
Yeah,
Why is it still number 2?
Yeah, let me just tag on to that with a little anecdotal story, because I don't think you're diminishing what it was, that it was a major problem at a time. But due to medicine, et cetera, the extent of the problem now is far, far, far lower, yet these federal programs still remain. In my little anecdotal story, I just happened to be flying on a plane with a guy, and this was about 10 years ago during the recession of 10 years ago, and he was running some federal department that provides housing for AIDS, people with AIDS or HIV, provides housing for them. Well, when it was a death sentence, that was a very important thing to have, a place for them to live, but it was a death sentence. Nobody's dying from it anymore to speak of, yet we still have this housing. And I said, wow, well, your budget, these are tough times. You're probably having tough times with your budget. And he says, no, we just got a budget increase this past year. So the federal government, once you put a program in place, getting rid of it, we all know, is next to impossible. So more and more money keeps going into federal AIDS programs, despite the fact that it is no longer a death sentence.
Right. That's under the Ryan White Act, which, yes, was inaugurated back when AIDS was a death sentence, but it keeps getting renewed every 5 years. And it's a little bit like there was a Spanish-American war tax imposed in 1898, and it wasn't repealed until the last decade or so ago. These things, it's called Newton's law of inertia.
Yeah. A
body in motion tends to stay in motion unless something from the outside interrupts it, which is also actually going on with the lockdowns. When you think about it, you stated it perfectly. The initial idea of the lockdowns, of flattening the curve, was never that we would get fewer deaths or cases out of it. No. You're not going to eliminate any part of the curve. You're going to flatten it. You're going to stretch out the cases so that we wouldn't overwhelm the healthcare system. Once we scored that goal, as it were, they had to move the goalposts, because to a great extent, it was simply a matter of inertia. Nobody thought about, well, what are we going to do once we scored the goal? And so we just keep going. We just keep mindlessly going and going and going.
Yeah, and it is mindless, because I keep asking people, okay, if not now, when? Right? That is the question about any lockdown right now, or for that matter, visiting your parents. I'm going to go visit my parents who are in their 80s or live in Arizona in a retirement community, and I'm going to see them next week. And there was a big debate among the family as to whether we should see them. I'm like, well, if not now, when? Are they going to not see their family for 2 years as we wait for this so-called cure, or if it to go away, which may never happen, and they're in their 80s, and so we're going to keep extending and extending and extending. So they had a well thought out, arguably, goal, which is not overwhelming the healthcare system. And I even say that, you know what, suspending some constitutional rights to make sure people aren't dying in the streets because we're so overwhelmed. Okay, I kind of get that. Maybe, but the mere objective of limiting the number of people who get sick as a reason for locking people down. No. I mean, we'd be locking people down for all kinds of reasons, you know, for drug addiction and for car accidents and so on. And obviously that's not a proper ground. So as you just pointed out, they've moved the goalpost, but nobody will tell us where it's been moved to.
Where those goalposts are.
Yeah, except perhaps, again, the LA mayor, I wrote about this recently in an op-ed, you know, he's the one who's come clean and said that the goalpost now has been moved to a cure. But let's go back to AIDS, and so complete the parallel that you're making between how we approach that versus what you're seeing today.
My point was the bad guys, as I call them, they don't see themselves as bad guys, but they were liars, and they intentionally lied, and they got away with it. They got away with it beyond their wildest dreams.
The ends justified the means in their mind, though, because they didn't want this to be a stigmatized community, the gays, et cetera. And so they said, let's pretend like this affects everyone equally. I totally agree with you, and I've always thought that, and you've proven it with your book. So, okay, keep going.
But it's not just the idea. It's the people themselves, because two of the biggest culprits, perhaps you've heard their names, were Anthony Fauci and Robert Redfield. If you look at my book, my 1990 book, Redfield is on 24 different pages of my book. Fauci is on rather fewer pages. But Fauci actually kicked off basically the hysteria with a paper that he solely authored in 1983, saying it looked like AIDS could be spread through basically like the flu. It could be spread within a family. He published that paper in 1983. The very next year, he was appointed to his current position at the National Institute of Allergies and Infectious Diseases. That was his reward for being spectacularly wrong, but wrong in the right direction. He was alarmistly wrong. Redfield was wrong basically just across the board, including co-authoring a paper that said your chance of getting AIDS through vaginal contact was 50% per sex act. So basically, after 3 acts of sex between a man and a woman, if one or the other had HIV, the other would get it. That's insane. It's probably on the order of thousands of acts of intercourse, thousands. So Redfield was spectacularly wrong. Fauci was spectacularly wrong. Fauci is now one of the 2 top infectious disease people in the country, and Redfield is the other one. It pays to be spectacularly wrong if you're wrong in the right direction. So my point of bringing all this up is the bad guys, as I put it, public health people, the media, they learn from AIDS that you can not just get away with this, but spectacularly so. So we have seen it time and again since. We saw it with avian flu that was supposed to kill millions and millions of people. It killed 400. We saw it with SARS that was supposed to kill millions and millions of people. It killed 744. We saw it with mad cow disease that a guy named Neil Ferguson said would kill as many as 50,000 people. It killed a couple of hundred. Neil Ferguson also weighed in on avian flu, a couple million there. Again, it killed about 400 people. Yeah, that's the same Neil Ferguson that came up with the model saying as many as 2.2 million American deaths from COVID-19. Neil Ferguson personally learned that the more outrageous you are, the more wrong you are, the more you are rewarded. All of these people have been taught. Ebola 1, Ebola 2, Zika virus. I wrote about all of these things. I was right, they were wrong. Look where I am, look where they are. Each and every faux epidemic, each and every faux disaster, these people learned we can get away with this.
Well, and also aren't doctors in general just kind of predisposed to give you worst case scenario, and that's kind of what they're doing. They want to err on the side of worst case scenario because, if you underestimated something, now you're really heads on a chopping block. But if you overestimated it, we erred on the side of extra caution, everybody's going to cut you some slack because, well, okay, thank God it didn't turn out to be that bad, but we erred on the side of caution.
Plus, there's the additional factor of, you always see this, they say the only reason it didn't turn out to be apocalyptic like we said it would be is because we said it would be apocalyptic. Because people listened to us and they took the proper actions. And that's never been the case. What incredible things did we do to fight Ebola? Nothing really. Ebola was always an African disease. It was always slated to remain an African disease. A few cases came by airplane to other countries, and nobody got infected from those few cases. SARS was always had a high lethality rate, was very, very hard to spread, just on and on and on. I personally wrote at the time, these things are exaggerated, these predictions are false. I didn't write in hindsight. I was right, they were all wrong. How is it that Mike Fumento, with no formal epidemiological training, no formal virological training or anything like that, how was it I was right and they were all wrong with their degrees and their positions and what have you? And it really comes down to, a couple of things. I hate being wrong. It just, it's an OCD thing. It just drives me nuts. I will put in any amount of research to not be wrong. But another thing is, I want to be right. I want to tell people the truth, whatever it happens to be. They don't want to be right. They don't want to tell people the truth, whatever it happens to be. They want to exaggerate.
And isn't the other parallel to AIDS that just as with AIDS, they wanted to make it appear that anyone can get this? With coronavirus, it appears very clear it affects the elderly and people with serious pre-existing health conditions, but they don't want people to think that, oh, no, this is just an elderly thing. It's just people with health conditions. And so they exaggerate how much it affects your average healthy person.
Right. You see it in the slogans like we're all in this together. It's just like AIDS. AIDS doesn't discriminate. For COVID, it's we're all in this together. No, we're not all in this together. Almost nobody in the United States under age 20 has died of COVID. Under age 20, you are less likely to get the disease. You are less likely to spread the disease. A lot of people don't know that. And you're much less likely to die of the disease. Almost no chance of dying of COVID if you're under 20. For that matter, if you're under 30, there's almost no chance of dying of the disease. It's basically, by the time you get to 60, 65, 75, 80, that's when your risks start to get real. And even there, as you pointed out, almost all of these people have pre-existing conditions. Diabetes, heart disease, asthma, things like that. The CDC, this is also a new CDC study, has found that 93% of all COVID deaths in the United States, those people had at least one pre-existing condition, and often 2, 3, or even more. So you can be almost as old as you want, but so long as you don't have something bad else going on, you're still probably not going to die of this disease.
Yeah, and it also explains why progressive politicians go for the lockdown, because they love equality. They love the utopian notion that everybody is the same. They don't like that one group is differentiated from another. So even if it's true that it affects old people or it affects sick people, so what? We're all in this together. Lock everyone down. They've got no problem with that.
Yeah, and unfortunately, we smacked right into the wall of unintended consequences. What we have found is that among those people who have died of COVID, an incredible percentage are people in nursing facilities. I might be confusing this with another country, but I'm guessing for the United States, it's around 40% of, it's not a guess, it's going to be around 40%. I don't have the data in front of me, of people who have died of COVID in the United States have been in nursing facilities. And that's just incredible. It's incredible negligence, really. So by pretending that we're all at equal risk, we have failed to protect those who are most at risk.
And what is the explanation, though, again, for why this has become what it's become today compared to the U.S. and the world's response to those other viruses that you were talking about earlier? What's your explanation as to why we reacted so differently this time?
I have a few theories, and they're really, when I'm talking data, I'll tell you I'm talking data. When I'm talking theory, I will tell you I'm talking theory. One theory is they have been building up over time. They were successful with HIV/AIDS. They were successful with scaring the crap out of people over avian flu, over SARS, over Ebola 1, over Ebola 2, over Zika virus, and probably a few hysterias that I fought that I don't even remember anymore because there have been so many. They've kept being successful, and so they've learned from each and every what works and what doesn't. For example, with Ebola, the WHO published a model showing 1.4 million deaths in just 2 African countries. I opposed it at the time. I said, this is asinine. There is no basis for this whatsoever. Total number of deaths in those 2 countries, 800, which means they were about 1.4 million shy of 1.4 million. But nobody was ever called to task for that. So they saw that they could get away with it. They saw how they could get away with it. I think they've been building up to this ever since 1987. That's part of it. They've been learning. Another aspect is social media. Now, social media, can be, it's a tool. It can be for good or it can be for bad. But if you look at what's happened with social media, if you look at Facebook, if you look at, I'm tempted to say Tinder, which is a dating app, Twitter.
Twitter.
If you look at Twitter, if you look at Facebook, they are both censoring. If you don't say the right things about COVID, you will be blocked. I've had a couple of bizarre things blocked. You can't make these things up. I jokingly posted a picture of my cat and said my cat was imposing self-quarantine. They pulled my cat's photo down. You can't make these things up. So when social media is censoring the so-called wrong things about COVID and allowing the so-called right things, then social media is definitely contributing to this as well.
And I presume you would say the 24-hour news cycle, I mean, that's only gotten bigger and bigger these days, and you have most of them lined up on the side of this being a big deal. And you've got a natural financial incentive to do that. I mean, we all know the media always overblows an earthquake, a flood, a fire. If you're the one living there, all of your friends from across the country are always calling and say, "Oh my God, it looks so horrible out there." And it's like, it's actually not that bad. So they've got a natural inclination of always overblown these type of things.
Yeah, there was a volcano erupted a couple of months ago. I don't know, 400 miles away from here. People were worried about me.
Right.
That's the way it goes. But you're right. Even, SARS was 2002, 2003, seemingly not so long ago. But I think the only 24-hour network at that time was CNN, maybe ESPN as well. But that's not exactly ESPN's ambit. But now, I mean, quite seriously, when this first broke out, I was referring to CNN as the Corona News Network. Everything on CNN, whether it was broadcast or whether it was CNN print was coronavirus. So they somehow worked coronavirus into everything. If it was somebody's 100th birthday, they worked in, wow, he's 100 years old and he's not dead of coronavirus. I mean, they work coronavirus into quite simply everything. You've seen these memes, so-called joke memes. Let's see, like man eaten by shark dies of coronavirus.
Okay, so let's talk about what is motivating the Faucis of the world. Is their heart in the right place? They're just being overly cautious in trying to protect lives, or is there something corrupt or sinister about their motives?
Well, again, both Fauci and Redfield, to be quite specific, rose to their very high positions through saying false things.
But their heart was in the right place. They were trying to save lives. And let's just say that they lied, but in their view, they were lying to save lives. So you shouldn't ever lie, right? But they thought that they had a proper motive to help protect lives, to get everybody invested in trying to find a cure for AIDS. So what about now? Could we say the same thing, that they're lying, but they're doing it to protect lives?
I tend to think that Fauci is an extremely intelligent man, whereas Redfield is basically stupid, which is, so I'm drawing a contrast there that, in a sense, kind of gives Redfield more of a buy than Fauci, if Redfield is acting out of stupidity. But, for example, I did a whole article on Redfield. Your people can look it up. Just put Fumento and Redfield into the browser, and you're probably, and COVID, and you'll call up my article, and you'll see, my God, how did this guy ever become the head of the Centers for Disease Control and Prevention when he says so many stupid things? But among the stupid things he said about COVID was that this is the worst outbreak of disease in over a century. Okay, wait a second. This is 2020. What happened 101 years ago? It was called the Spanish flu. Maybe you've heard of it. The worst epidemic in modern times. Millions and millions of people died worldwide. The U.S. death toll was utterly fantastic. Utterly incomparable to anything we've seen probably since the Black Death, which was, 800 years ago. Does Redfield's never heard of the Spanish flu, honestly? And the answer may be yes. The head of the Centers for Disease Control has never heard of the Spanish flu. I can't answer that for you. I called the CDC, and I politely put in the question, knowing they would never get back to me. And of course, they didn't get back to me. I think he's just plain stupid. But Fauci's a very smart guy. So, when you ask me when it comes to lying, you're going into not whether they're telling you the truth or not. You're going into mental state. And that makes it very tough for me to call anybody a liar. Very easy for me to say they're saying false things. Very tough for me to say they're lying.
Well, or, exaggerating or erring on the side of extreme caution. But bottom line, it sounds like you're not ascribing, look, there's lots of conspiracy theories out there. Lots of people saying, oh, Fauci's got some financial interest in this, that he's going to make a ton of money if there's a vaccine and this, that, and the other. You're not seeing any of that type of conspiracy here. You're just seeing perhaps a guy who's spent his whole life on infectious diseases, and this is his moment in the sun, and he's quite excited about it.
Yeah, there's a term I coined during the AIDS epidemic where I said, I don't see so much a conspiracy as a meeting of the minds. Now, mind you, there was a conspiracy during AIDS, in fairness. They really did get together in smoke-filled rooms, as the expression goes, and they really did decide between themselves that we have to grossly exaggerate the impact of this epidemic and and how widespread it will be, or else it's not going to get the kind of funding and the kind of attention it deserves. There literally was an AIDS conspiracy, but there was also simply a meeting of the minds where, without conspiring, they simply decided individually or as groups, look, we got to do this. We just got to do this for AIDS. And I think you're seeing this again. Thus, for example, the CDC okay, here's the facts. To have COVID-19 on your death certificate, you don't need to die of COVID-19. It's right in the CDC's promulgation. The CDC says if it appears basically the patient may have died of COVID, you can put that on the death certificate. You don't need a test. Well, what's in the news today? Is the flu in the news? Is heart disease in the news? Is asthma in the news? No. What's in the news is COVID-19. And you can't really just look at a corpse and go, COVID-19 versus non-COVID-19. Even if that corpse was tested, you still can't do that. In other words, you can say this person had COVID-19, but the person also had asthma, heart disease, diabetes, and 3 other pre-existing conditions. And you can't automatically say which one of those it was. But since COVID-19 is in the news, what are you more likely to put on that death certificate? Yeah. Right, COVID-19. But it gets worse than that. This is a story I have coming out tomorrow, hopefully. In Colorado, a man was found dead in the park with double the amount of alcohol in his system needed to kill him. The coroner dutifully wrote on his death certificate, died of alcohol poisoning. The State Department of Health and the Environment, for its official statistics, changed it to COVID-19.
Is it true, this rumor?
It's like the shark meme.
There's an internet rumor going around. I call it a rumor because I haven't tracked it down myself. Maybe it's more than a rumor, but that Medicare pays X amount of dollars if it's a COVID death. Have you run that down and seen if that's true or not? There's a financial
Yes, I've run
incentive?
it down. It's half rumor and it's half true. The half rumor is that you get a bonus if the person is put on a ventilator. That's not true. The truth is that under the CARES Act, passed in March of this year, specifically for COVID-19, under the Medicare system, if you put COVID-19 down on that death certificate as opposed to anything else, you will get a 20% bonus from Medicare. That's a fact.
There you
look
go.
that up.
Well, you know,
now,
yeah.
So okay, you're already, you're inundated with news about COVID-19, COVID-19, COVID-19. You got a corpse, and you're not entirely sure. Was it asthma? Was it heart disease? Was it COVID-19? Well, Medicare is going to give you a 20% bonus if you just happen to put COVID-19 on the first line of that death certificate instead of something else. Maybe that's going to push you in the direction of COVID-19? You think?
Yeah, clearly. Well, and going back to the CDC and them, as far as how you categorize a COVID death and so on, and them overestimating how big this thing's. To be honest with you, some of that doesn't bother me so much because I just know they're always going to be extra cautious. Doctors are going to be extra cautious, extra warning you. If you go to your own doctor, don't drink, don't smoke, don't eat red meat. Nobody listens to their doctor. So I almost blame the politicians more for just 100% buying into it and only seeing what they're saying, handing it over to somebody like Fauci to decide when we're going to be reopening, as opposed to looking at him and say, okay, thank you very much, medical community. We hear what you're saying as far as the potential risks, but we're also going to listen to economists, and we're going to listen to constitutionalists about what our Constitution allows and so on, and then we're going to make a decision based on that, as opposed to simply relying on these medical professionals that we know always exaggerate this kind of stuff.
right? You know what they're going to say ahead of time. Don't get me wrong. There have been epidemiologists who have been very honest about this, although almost all of them are in Europe for some reason. And but nobody voted last I checked for Robert Redfield, and nobody voted for Anthony Fauci.
Or for these
Although,
local health officials that we have in various
right,
states and cities.
Right, the Michael Osterholms from Minnesota and so on, guys who have been wrong for every epidemic since I was born.
Barbara Farrar here in LA County, I've been writing about her and sharing her bio and what her education is, and it's all about healthcare inequality and outcome equities and this and that, all big time progressive agendas.
Yeah, I'll never forget that when my AIDS book was actually extremely well reviewed. It was literally banned. Don't get me wrong. A lot of stores and even chains refused to carry it. But it got great reviews from JAMA and the New England Journal of Medicine and this and that. But it did get one particularly bad review by a communist. I mean, an avowed communist. Communists actually play a very important role in public health. The current head of the WHO is a member of the Communist Party. That's not a joke. The last head of the WHO was Chinese and presumably a member of the Communist Party. Communists literally gravitate towards public health in the same way that liberals gravitate towards journalism. It's just, it's one of those things. So we are, I mean, literally, I don't want to be, sound like a red baiter or anything, but literally we are, when we give these people a lot of power, we're giving power to people who believe in utopianism, who believe in the leveling out of incomes, who believe the rich countries, who believe that bringing down the rich countries brings up the poor countries. That's what we're dealing with. And our elected officials should be the barrier between us and them. And they're not doing their job. They're not doing it in Los Angeles, in the state of California, in Illinois, in the city of Chicago, in the city of New York. They are making very bad decisions.
Very, very well put. It's getting very late there, so I promise this is the last question. We've been kind of assuming that Wuhan was way worse than the Chinese have been disclosing. They're hiding something. There's piles of dead bodies. They're being incinerated, and there's spy satellite photos of this, but we haven't seen it, and so on and so forth. But I'm starting to think that more I see this and see 7% of Swedes have it, despite the fact that they didn't lock down, so it hasn't been near as contagious as we thought, hasn't been near as deadly as we thought, that maybe China actually did accurately report the Wuhan numbers. We're not going to find out that they were grossly understated. What are your thoughts on that?
It's going to take a while before the truth actually trickles out of China. They're in terms of news, they're locked down pretty tight. The word coming out of North Korea is that they're having an absolute disaster, as one would expect from North Korea. China is really hard to say, but yeah, I'm guessing towards your position that that they have such power to control their people. Mind you, the photos you may have seen of people being welded inside their houses, fake news. Just like did you see the picture of the rows and rows of coffins in Italy? Oh my gosh, that was so scary. Fake news. So much of these things are fake news. So yeah, I'm guessing that probably China was not nearly as hard hit as a lot of people are saying, but with China, who knows?
Yeah. Can you ask one question? Michael's got a quick question. Yeah.
Just his take on Michael. Just your opinion. Why is there such pushback within the U.S. on the hydroxychloroquine?
The studies I've seen are not particularly supportive of that. Some studies say yes, but most of the studies say that it isn't particularly effective or isn't effective at all. All that said, another factor going on here, which I kind of forgot to mention, was Donald J. Trump. The media hate Trump with a passion. As I already pointed out, the media are left wing. I personally am not a Trump supporter. I didn't vote for him. I don't intend to vote for him in November. That said, I think a lot of what's going on is to go after Trump. I mean, these people literally, they either thought through it or they haven't really thought through it. I think a lot of people want to destroy the economy because it will be very difficult for Trump to be reelected if we have a destroyed economy basically in November.
Well, here's a less sinister way of looking at it, Michael, but agreeing with you that they are invested in the narrative that Trump did not do enough to stop this. This is Trump's fault. I'm hearing this again and again. They want to blame Trump for this. Well, in order for that to work, this thing had to have been a big deal. If this thing's not a big deal, then Trump did an okay job. But if this thing's a big deal and Trump failed to stop it, then you've got a problem. So they are invested in the narrative that Trump failed to stop this thing, failed to take the proper actions, and this thing is a really big deal. And that's why they're hanging on to the idea that this is a really big deal so that they can hang Trump in November, saying that, because everybody's saying this is a referendum. November's a referendum on how Trump handled the coronavirus. So they need to subscribe to the idea that this thing's a really big deal and he failed to take proper action.
Right. Such things as if we had only locked down a week or two earlier, we would have saved X number of lives. Okay, here's one for you. The CDC was 5 weeks late in coming out with a coronavirus test. They could have gotten one essentially free of charge. I mean, the formula, free of charge from the WHO. But the CDC decided, nah, we're going to make our own. And then they blew it. They contaminated their early coronavirus tests. So we were 5 weeks late in being able to test people. That had absolutely nothing to do with Donald J. Trump. It had everything to do with whom? Robert Redfield. And nobody has held Redfield's feet to the fire on that except your current guest.
And real quick, why did he reject the test from the WHO?
Actually, it's not that unusual for CDC to say, we think we can do a better job. I think in retrospect, everybody at the CDC except for Redfield would tell you, yeah, we kind of blew it. We should have gone with the WHO.
And we know that order did not come from the White House.
Nobody's looked into that. You can read one article after another saying the CDC blew it. But nobody ever says that the chief of CDC blew it. Nobody ever brings up the name of Redfield.
But I can certainly see the left really trying to hang Trump with that, because that would be a very Trumpian thing to do. And I think I've heard people allude to the fact that or accuse Trump of rejecting tests from the World Health Organization because it is what it is, and America first, and we're going to make things in America.
Now, Trump had absolutely nothing to do with that. And of course he had absolutely nothing to do with it. How is a president supposed to make a decision like that? That is a decision made by the head of the CDC in consultation with the people below him. So Redfield, of course, it is Redfield's fault. Let's add to this that Redfield spent much of his career in the Army. He was a colonel. He was in the Army just like I was. I was a non-com. He was a com. Everything that anybody did under me when I was a sergeant, I had to accept as my responsibility. If they got drunk, if they beat their wives, if they showed up late for formation, as the sergeant, I was responsible. Redfield should know that as a colonel, he should be held to military standards. Everything that goes wrong at the CDC, whether it's a broken coffee maker or anything like that, basically is Redfield's fault, and nobody has attributed this to Robert Redfield. And I think the reason is because he said all the right things during the AIDS epidemic.
Yeah. Well, I tell my progressive Democrat friends that, hey, if you want to attack Trump, attack him for the fact that he's got Fauci and Redfield in place. Those are his guys. Attack him
I am on record criticizing Trump in the New York Post for having appointed Robert Redfield.